Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding.
You know, while millions of us are sound asleep tonight, there's this hidden battle going on. It's called sleep bruxism. For years, the main line of defense has been this, clunky piece of plastic you put in your mouth. But what if that's just a shield and not actually a cure? Okay, let's really dive into this hunt for a real solution.
Has your partner ever nudged you awake? Or maybe your dentist raised an eyebrow and pointed out some unusual wear and tear on your teeth? Well, if so, you are definitely not alone. This is the reality for so many people, and it's pretty much the starting point for our whole conversation today. So what is this thing exactly?
So let's get on the same page with the official definition. Sleep bruxism, or SB for short, is this repetitive, totally unconscious jaw muscle activity. And listen, this isn't just some bad habit. It's actually classified as a sleep-related movement disorder.
All right, first up, let's get into the mystery itself. I mean, it's super common, but the why behind sleep bruxism has been a real puzzle for a long, long time. And a lot of the old ideas about it are now getting seriously challenged.
For years, everyone just blamed a bad bite, or they chalk it up to stress. But what's so fascinating is how much that thinking has shifted. The latest research is pointing away from your teeth and even away from just daily anxiety and looking deeper into the central nervous system. It seems to be an issue with brain signals, with your body's fight or flight system. That's the autonomic arousal part, just kicking into high gear while you're fast asleep.
So wait a minute. If it's a brain issue, why is the go-to treatment something you get from your dentist? Well, this brings us right to the heart of the problem, the good old mouthguard and, all of its limitations.
And this just lays out the whole issue perfectly. Over on the left, you've got the mouthguard. And yeah, sure, it protects your teeth. It's a shield, absolutely. But it doesn't stop the grinding. And honestly, a lot of people just can't stand wearing them. So on the right, that's the holy grail of modern science, moving past the shield to find something that gets to the root cause in the brain and actually dials down that muscle activity.
So, naturally, this search for a deeper fix leads us straight to the medicine cabinet. Is there a pill that can just calm the grind? Let's take a look at what the research has to say about that.
This table really sums up the whole pharmacological roller coaster, doesn't it? I mean, look at the pattern here. In that middle column, you see a bunch of down arrows, which means these drugs can reduce grinding. But then you look at the column on the right, the catch. Benzodiazepines, big risk of dependency. Drugs like clonidine can cause serious side effects like low blood pressure, and others are just a total mixed bag. So the bottom line is there's no magic bullet here, not even close.
And if you thought that was complicated, get ready for this. A huge review of all the studies came to a pretty shocking conclusion. There are actually more medications out there that are known to cause or worsen bruxism as a side effect than there are drugs that are proven to treat it. It's this incredible and, frankly, frustrating paradox. And this leads to a super important warning. Two of the most common types of antidepressants, SSRIs and SNRIs, fall right into that category. So just imagine, for someone dealing with both anxiety and bruxism, the very drug they're prescribed for one problem could be making the other one a whole lot worse. The research is pretty clear. These are not good options for managing sleep bruxism.
Okay, so if pills are kind of a minefield, what about trying to retrain the brain? Is it even possible to unlearn a behavior that you're not even conscious of doing in the first place? Let's check out the world of behavioral interventions.
So one of the more, let's call them intense methods, is this thing called arousal with overcorrection. As you can see, it's a whole process. Your partner hears you grinding, they have to wake you up, that's the punishment part, and then you have to literally get out of bed and do a full 10-minute dental hygiene routine. The theory is that you're conditioning your brain to think, I'd rather just not grind than have to get up and do all.
But here's the massive challenge with most of these ideas. Therapies like habit reversal, where you become aware you're doing something and consciously replace it with a different behavior, they're great when you're awake. But there's almost no evidence that these daytime tricks can actually cross that barrier into your unconscious sleeping mind.
Well, what about technology? There are these biofeedback devices that give you a little stimulus, like a vibration or a tiny pulse whenever they detect grinding, and they have shown a little bit of promise, but we've got to be careful here. A major review of all the studies concluded that, frankly, the research is pretty low quality and likely biased, so the jury is still way out on that one.
Okay, let's switch gears and look at some of the alternative routes. This is where we get into some of the treatments you might have heard about, from Botox injections all the way to complementary medicine.
So first up, botulinum toxin. Yeah, Botox.
How it works is it basically weakens your jaw muscles. And this is a really key point. It doesn't stop your brain from sending the grind now signals. So the frequency of the grinding stays the same. It just reduces the force of your clench. But as you can see, the effects only last a few months. It can cause problems like difficulty chewing, and man, is it expensive.
So, given all those downsides, the expert opinion is pretty darn clear, and this quote from the research really just says it all. Botox is not your first stop. It is a last resort, meant for severe, extreme cases where the damage from the grinding is actually worse than the risks and the cost of the treatment itself.
And what about those other alternatives? Well, when you look at hypnotherapy, acupuncture, and supplements specifically for stopping sleep bruxism, it's pretty much the same story across the board. Some of these might help with related stuff like facial pain, but the hard scientific evidence that they actually reduce the grinding itself, it's just weak or, in some cases, totally non-existent right now.
So wow, after going down all these different roads, pills, brain training, alternatives, where does that leave us? What's the real clinical bottom line here? Let's try and boil this all down into the most important takeaways.
Takeaway number one is honestly a pretty humbling one. The evidence for a true cure just isn't there yet. Outside of the mouth guard that just protects your teeth, almost no treatment has been studied well enough to be recommended for everybody. A real, definitive cure is still out there. Somewhere, though. A couple of medications do show enough promise that they're worth researching more.
The second huge point is all about medication. You have to proceed with extreme caution. For the few drugs that do seem to have some effect, the risks are very real, which means low doses, short-term use, and constant medical supervision are a must. And it is absolutely worth saying again, common antidepressants are a bad choice here and can actually make things worse.
And our final takeaway is simple. Reserve the big guns. Botox does have a place, but it's a very, very specific and limited one. It's for the severe cases, after everything else has been tried and failed, and only when the situation is so bad that the benefits of this powerful intervention finally outweigh all the costs and the risks. So we kind of end up right back where we started, with this understanding that sleep bruxism isn't a dental problem. It's a brain disorder. That mouth guard is just a temporary shield for a much, much more complex battle. And all of that leaves us with this final, forward-looking question. As we get better and better at mapping the brain's mysterious nighttime activities, what will the true cure for the nightly grind finally look like?
Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.